Hello class, my name is Joe Garcia. Today I'll be doing my presentation on the tensor fasciae latae muscle. Okay. All right, so the origin and insertion. The fasciae latae is a fibrous sheath that encircles the thigh and tightly binds its muscles. On the lateral surface, it combines with the tendons of the gluteus maximus and tensor fasciae latae to form the iliotibial tract, which extends from the iliac crest to the lateral condyle of the tibia. Right? The origin is going to originate from the anterior iliac crest, connecting from the anterior superior iliac spine. It's going to insert into the iliotibial tract, which itself connects to the lateral condyle of the tibia. So right here we have an example there. Pretty easy to follow. Right, movement and muscle actions possible. Its main functions. It's going to help in flexing and abducting the thigh. It's going to assist the gluteus medius and minimus in abducting and medial rotation of the lower limb. It also performs as a supportive role of the gait cycle. Prime mover in hip medial rotation and a weak hip abductor motion. It assists in lateral rotation of the leg, and it also assists in keeping the balance of the pelvis while standing, walking, or running. Okay, examples of daily use. It's going to assist in walking and inferiorly tilting the ilium on the weight-bearing side, with the result being an upward tilt of the contralateral of the hip, thus allowing the leg of the non-weight-bearing hip to swing through without hitting the ground throughout the swing phase of the gait. Okay, if you're wondering what the gait is a continuous cycle of the body support during stance phase and controlled limb advancement during swing phase. Here in the bottom picture, I have an example of that. Here you have your initial contact, going to the loading response, mid stance, terminal stance, and pre-swing. That's all gonna fall under your stance. Okay, and then after that, you're gonna have your swing, which is going to be your initial swing, mid swing, and terminal swing. And that's all gonna be what you are doing during walking. All right, strengthening exercises. All right, one of the exercises we can do here is side lying leg abduction. You're going to do this by lying on one side, supporting your head by bending the arm closest to the floor into a comfortable rest. Ensure you're lying fully on your side and that your hips are vertically aligned. Okay, bend the leg closest to the floor for stability. Strain your top leg, flexing your foot upward at a 90-degree or larger angle. Raise your leg and slightly back at a 50 to 70-degree angle from the floor. You're going to return to starting position after that. Keep your leg straight and your foot flexed throughout the exercise. And then your foot should not touch the floor until you're done with the exercise. And below there we have an example. Okay, for progression, you're going to apply a resistance band between your legs, 10-15 reps, 4 sets. And for regression, probably without shoes so that we have less weight at the end of your leg. Reps around 5 to 7, and we're going to do 4 sets. Okay, another exercise we have here is a hip abduction with a cable. Okay, to do this, you're gonna stand next to a secure wall or pole with the built-in cable attachments. Adjust the cable attachments so they're at the ankle level. Choose an appropriate weight or resistance. Affix the cable to the ankle of your outside leg. Position your inside leg behind the cable with your foot flat on the ground. Okay. After that, you're gonna slowly raise your outside leg without bending your knee or moving your hips. If you need extra balance, lean one hand against the wall or pull beside you. Slowly bring your leg back down to the floor, and then you're going to repeat that. Okay, and then we have an example there off to the side. You're going to usually find these machines at any kind of gym that you have nearby. Progression, obviously you're going to go up in weight. Not so much that you're going to hurt yourself. Reps, you're going to be doing around 8 to 12, sets 4. And for regression, you can do the same exercise, still holding onto the pole or wall without the use of the cable. So just your leg. Reps, you're going to be doing 8 to 10 and 4 sets still. Okay, stretching exercises. The first one we have here is a standing knee bend. Okay, you're going to stand up and hold on to something for balance. And if you don't need to, then that's perfectly fine. Bend your knee backwards, hold onto your ankle, and pull your foot forward to your buttocks. Keep your knees together, aligned with one another. Engage your buttocks and push your hips forward. Push your hips towards the side you are stretching. Okay, the second exercise that we have here is going to be the lunge. Okay, assume a lunge position with your hands on your hips. Okay, the leg at the back will be the side that is stretched. Make sure you have both feet in line with each other. Keep your pelvis facing forward at all times. Tilt your pelvis backwards and push your hips forward. Then you're going to lunge forward and push your hips out toward the side of the back leg. Okay, for possible injuries, okay, we have a tensor fasciae latae sprain. Okay, this can occur during numerous activities which uses the muscles such as running, excessive walking, dancing, climbing, cycling, and some sports such as tennis, basketball, and etc. Symptoms include pain in the outer part of the thigh, pain on the outside part of the hip. Okay, pain worsens when the affected muscle is being used, and pain worsens when lying on the affected muscle. Okay, treatment for this usually consists of heat, rest, and flexibility exercises, such as iliotibial band stretching. And that's all I have for you guys today. Thank you for your time.